COVID-19 has hit Canada's long-term care homes hard. More than 3,300 deaths in long-term care homes are linked to outbreaks. That number is 82% of Canada's total death toll from the pandemic. This weekend, NDP leader Jagmeet Singh called for Canada to do away with private care homes. He joins us this morning to talk more about this proposal. First of all, Mr. Singh, thanks for being with us here on Your Morning. How would public ownership of these long-term care homes have helped in this particular crisis?
Well, one of the things we've seen, the evidence is that some of the worst conditions where seniors were kept in the worst conditions were in the private for-profit long-term care homes. And what we know is when there's a profit motive, there's corner cutting for the quality of care. And in general, we know that the figure that you cited, it's heartbreaking to think that the vast majority of deaths as a result of COVID-19 have been in senior homes, have been seniors, those who have worked their whole life. So we owe it to them to take far better care of them. A care guarantee, we need better public funding of long-term care homes. We need to have a care guarantee that's national where we work with provinces to develop a standard. What does it mean to make sure that your loved ones are cared for when they're in a long-term care home? That there is no worry.
I think a lot of Canadians can get behind the sentiment of what you're saying. And if we take the focus off of profit, we still have to think about money. And there are a few hurdles to making all long-term care public in Canada. First of all, the cost of doing so, and then the fact that healthcare is a provincial jurisdiction. So how would you overcome those hurdles?
Well, it certainly would remain in terms of provincial jurisdiction, but similar to the Canada Health Act, the transfer of money from the federal government to provinces is determined by a set of criteria that there has to be quality care, it has to be publicly funded, it has to be accessible, it has to be universal. So if we keep that similar set of priorities and develop something that's focused on long-term care, a Canada Long-Term Care Act, which requires certain key things that need to be in place so that federal funding could go to provinces. Provinces, I know, want to respond to this. This is completely wrong. The treatment we've seen of seniors in long-term care homes, we need to do better. And we can work together with provinces to do better. We need more funding, for sure. It's going to cost, absolutely, but the cost of not doing anything or the cost of going back to normal is seniors dying in massive numbers, and we're just not going to go back there. There's no way.
What part of the healthcare sector would you pull that money from, or would you look at increasing taxes to pay for this?
We would, similar to when we've seen governments make something a priority, they find money to do it. I think we can all agree that seniors deserve it, and we should absolutely find the money to invest in seniors. We've talked about revenue sources, and one of the really clear ways we can do that is clamping down on offshore tax havens. We've talked about those who have fortunes of over $20 million, that they can contribute a little bit more. There's many ways for us to increase revenue, but when something's a priority, governments find the money to do so. In this case, this is a priority. We have to take care of seniors. There's really no other option.
Something that we've discussed on this show is protecting and paying their staff. Some saying they don't even earn enough for the work that they're doing. Can the government not work with private homes and then mandate staffing levels and pay? Do it that way?
Well, first of all, your question around the staffing is very vital. It's a very important question. We know that workers are not getting paid enough. They work in multiple homes as a result. And then the risk of a transmission of illnesses from one home to another, from one long-term care home to another, is a higher risk. So that's something we absolutely need to find out a way to deal with that, which means making sure those workers are paid adequately. The for-profit or the privatized model means that there has to be some cost cutting, some focus on making sure there's a profit made as opposed to making sure there's quality care. And we've seen the evidence. Those are some of the sites of the worst conditions where seniors have had just deplorable conditions of their treatment, and we've seen massive deaths. So the evidence is that those centers are not good enough, and it's not there's really no place for profit in the care of our seniors. It doesn't really make sense, and that's why I think that we need to move away from that.
I think we can all agree on the fact that the outcomes have been tragic. Thanks so much, Jagmeet Singh, for joining us this morning.
Thank you.
Thanks for watching. If you like this, be sure to subscribe here.
And you can check out more Your Morning videos right here.